Hi, my name is Todd Price. I practice infectious disease here in Houston, and I'm also president of International Medical Outreach.
And my name is Sue Price, and I'm a registered nurse. I'm manager in Todd's private practice, and I'm co-founder of International Medical Outreach and executive director. And International Medical Outreach was founded in 1993 with a suitcase of donated medicines and a 2-week vacation. Our first destination was Nepal. Our second destination was Philippines, and since then we've been to about 40 different countries. We haven't been to 40 different countries, we've had projects in about 40 different countries. Because of our expertise and our experience over the last 30 years, most of our resources and efforts go towards infectious diseases, the treatment and the prevention of it. It's not pleasant to talk about infections or communicable diseases, but it's important for people in our position to be aware and to be knowledgeable when we go into other into other cultures, even if we go to offer assistance. It's good that we are aware of their natural world and their environment, and we're in a better position to actually help them.
Infectious diseases are a major cause of death, disability, and social and economic turmoil for millions of people around the world.
So we met Richard in the green shirt in Burundi. His mother brought him to our clinic. She carried him everywhere, and she didn't know why he couldn't walk. So we examined him, and we couldn't find any reason why he couldn't walk. Everything seemed to be intact. But he's got, as you can see, he's got obvious signs of malnutrition. He's got edema of his feet and his ankles. He's got dermatitis. He's got hair loss and irritability with that classic scowl. And so we treated him. He was diagnosed with many different types of intestinal parasites. And we treated him, and this is the same little boy sometime later, several months later. Illness and death from infectious diseases is particularly tragic because most of them are preventable and treatable. 3 diseases, diarrhea, pneumonia, and malaria, account for 52% of child deaths worldwide. And for each one of those diseases, diarrhea, pneumonia, and malaria, there's one effective prevention and there's one effective treatment. But large populations living in developing countries, they don't have access to adequate treatment for infectious diseases. Or a lot of these people don't utilize available treatment or interventions. Why? I'm sure we can come up with a lot of reasons why, but poverty, they simply can't afford it. Distance, they live in remote areas outside the reach of health services. Failure of the healthcare system. If the healthcare is poor, there's no demand for it. Shame. Many of these diseases are taboo subjects, and the governments and people are ashamed. They won't admit it, and therefore they can't tackle the consequences. So today we want to highlight a specific category of infectious diseases as opposed to the big 3 that get so much attention on the world stage. The big 3 being malaria, tuberculosis, and HIV.
This is a 7-year-old boy with fever whose rapid malaria test was noted to be positive. In addition, his hemoglobin was 2.2, normal is 12 to 15. And he was also suffering from heart failure. He was transfused with packed cells and given artesunate, a treatment for malaria. Malaria, over 1 million die each year. Of these deaths, most are children under the age of 5 years old. 300 to 600 million people suffer from malaria each year, and a child dies of malaria every 55 seconds.
So we're not going to talk about tuberculosis today either, but we could.
This is an 8-year-old boy who was brought into our outpatient clinic with abdominal pain. He was known to have a fever to 39 degrees Celsius with a rapid pulse and low blood pressure. He was initially treated with artesunate for malaria and also ceftriaxone for the possibility of typhoid. But his abdominal pain and fevers persisted and progressed, and ultimately he underwent a laparotomy. The laparotomy revealed that he had peritonitis, and a smear for TB was positive. He therefore was placed on isoniazid, pyrazinamide, and rifampin. TB is the top infectious killer worldwide, outranking both malaria and HIV. 40% of HIV deaths are actually due to TB, making it the top killer of those with HIV. 1/3 of the world's population are infected with TB, 1 out of every 3 people. TB is everywhere and in every country, and there are multi-drug resistant forms and extreme drug resistant forms. The treatment success rate for those with just regular TB is about 83%. Those with multi-drug resistant TB is 54%, and those with extensive multi-drug resistance is only 30%.
And we're not going to talk about HIV today either, but we could.
This is a 32-year-old man from the DRC, the Congo. He was admitted with diffuse general body aches, blood in his sputum for 3 months, and a growth on his tongue for 2 months. At admission, he was cachectic with muscle wasting, and he had a fever. Although he had no respiratory distress, his exam revealed crepitance on the left side of his chest. On his tongue were several tumors. Initial laboratory testing revealed TB smears ×2 negative. Hemoglobin was 8. He had a negative rapid malaria test, but a positive rapid HIV test. He therefore was started on folic acid, intravenous chloramphenicol for the possibility of typhoid, and highly active antiretroviral therapy. Over 35 million have lost their lives from HIV so far. In 2016, 1 million people died from HIV-related causes. Approximately 36.7 million people are now living with HIV, and of these, 25.6 million are in Africa. 1.8 million people became infected in 2016, and 2/3 of these were in Africa. There's no cure for HIV, but antiretroviral drugs control the infection and help prevent transmission so that those with HIV can live long, healthy lives.
So as you can see, despite the attention and the funding, these 3 diseases, malaria, tuberculosis, and HIV, are still making a significant impact on vulnerable people worldwide. But today we want to focus on a category of diseases that haven't benefited from such funding. Neglected tropical diseases, or commonly referred to as NTD. There's some debate over how many diseases are in this category. Some say there's a core group of diseases of 12, but the World Health Organization came out with this most recent list of 18. One reason they made me neglected is because you can't pronounce most of them. But NTDs are a diverse group of communicable diseases that prevail in tropical and subtropical conditions, impacting 149 countries out of 195 countries worldwide. They're called neglected diseases because they've mostly been wiped out of more developed countries, and they persist in the poorest and most marginalized countries of the world, but 149 countries. And here's a few interesting facts regarding NTDs and the reason we're highlighting them today. They affect more than 1.4 billion people. Now, the Earth, the population is approximately 7 billion. So 1.4 billion people is about 1/6 of the world's population. And that includes 500 million children. And these diseases cost governments billions a year, every year. 100% of low-income countries are affected by at least 5 NTDs simultaneously. Many of these conditions are very painful and debilitating. And in addition to causing physical and emotional suffering, these diseases they cause disfigurement and deformity, and therefore patients are stigmatized and ostracized. On the other hand, many of these diseases are preventable and treatable. For some of these diseases, medication is safe, intervention is easy, inexpensive, simple, and can be carried out by non-professionals. So we can't present all of these diseases today, but we thought that we would show you what 4 of them look like.
This is a 4-year-old female who was admitted to Naipea Hospital in Uganda with weight loss, brown hair, with apparent wasting syndrome and oral thrush. Her abdomen was distended but non-tender. She was anemic. Her hemoglobin was 7, and she weighed 6 kilograms. That's 6. Her HIV test was negative, as was malaria smears, but her stool was positive for hookworm and ascaris. She was started on nutritional formula and albendazole. Ceftriaxone and gentamicin were started for pneumonia. This girl has soil-transmitted helminthiasis. These diseases are caused by different species of parasitic worms, including hookworm, roundworm, pinworm, whipworm. They are transmitted to humans via human feces in soil where sanitation is poor. There are 5 F's of transmission. Feces, transmitted by fingers, contaminate food carried by flies, and in situations where open defecation and practice are picked up in the field. Approximately 85% of all NTDs that were listed are due to this category, soil-transmitted helminthiasis. The World Health Organization reports that 1.5 billion people, 24% of the world's population, are infected. Over 267 million preschool-age children and over 568 million school-age children live in areas where these parasites are transmitted intensively. Infected children are nutritionally and physically impaired to the point of stunting. Those that are stunted on the growth charts are also stunted in IQ development. Both albendazole and mebendazole treat these diseases and are utilized in mass treatment campaigns. Yet adequate control cannot be achieved unless preventive measures are also introduced.
So soil-transmitted helminthiasis, that's intestinal parasites or intestinal worms.
This is a 29-year-old male with no previous medical history who presented to Zeu Health Station, also in Uganda, with a right foot wound. He evidently had a rash, scratched it, and an eschar developed, for which he received several injections of ceftriaxone with minimal improvement. On exam, he was found to be afebrile with this necrotic ulceration, and on the sides, you see hypopigmentation. This is Buruli ulcer, and it's a chronic debilitating disease caused by Mycobacterium ulcerans. It's the 3rd most common mycobacterium in the world. The first 2 are tuberculosis and leprosy. It often affects the skin and sometimes bone and can lead to permanent disfigurement and long-term disability. Most patients are children under the age of 15, and most of them live in rural West Africa. The mode of transmission is not really known, The bacteria does produce a toxin which causes local skin destruction. And the skin lesions may start as small papules, nodules, plaques, and they progress to ulcers. Ulcers are characterized by undermined and indurated edges with associated hypo or hyperpigmentation. Treatment is with rifampin and streptomycin and application of heat. So this is Buruli ulcer. Next is a 65-year-old male who presented also to Zayu Health Station with a wound in his left foot. Evidently, he developed burning pain in his left leg and foot 4 months prior to his presentation. And since then, the wound has progressed from a small foot ulcer to involve his entire leg. On exam, he's afebrile with a normal blood pressure and demonstrated an extensive wound on the medial and lateral left foot and leg with pus and granulation as well as heaped up borders. The most common bacteria of any skin and soft tissue infection is Staphylococcus. Exposure history, however, can change the expected bacteria flora. If there's exposure to spiders, like a spider bite, then the most likely bacteria would be resistant staph, like MRSA. Snake bites, Pseudomonas. If there's any exposure to leeches, Aeromonas. If there's any exposure to brackish water, then Mycobacterium marinum or Vibrio species may be playing a role. And of course, diabetic foot ulcers are typically polymicrobial. And so the places that we go where there's low access to antibiotics, bacterial resistance is very low. And therefore, any antibiotic that you start with will work. But these can develop resistance quite rapidly, and therefore these lesions, these ulcers, should be monitored very closely. So that is tropical wounds. This is a 9-year-old boy who was found outside his hut when we approached him, and he appeared to be malnourished and listless. He was found to have multiple nodules around his fingernails and toenails. Upon closer inspection, some appeared to be ulcerated with yellow honey-colored crust, others with dried blood with surrounding redness, but most with the central dark lesion surrounded by a yellow pustule. Inspection of his older sister and 2 brothers, all who also appeared to be malnourished, revealed similar lesions. Upon ambulation, all avoided placing a full weight on these lesions by walking on the sides of their feet or otherwise ambulating with difficulty. This is one of the most debilitating diseases in all of sub-Saharan Africa. It prevents millions of children from attending school. It stops farmers from working their land. It makes walking all but unbearable. Millions live in poverty because of this infection. It's native actually not to Africa, but to Central and South America. And it was first described back in 1526 among the crew members of the Columbus ship Santa Maria when they landed in Haiti and contracted it there. Subsequently, it spread worldwide, aided initially by the practice of dumping sand ballast on different shores. This is caused by Tunga penetrans, the sand flea, and the parasitic infestation is called tungiasis, or commonly known as jiggers. The first evidence of infestation by this sand flea is a tiny black dot on the skin at the point of penetration. Reservoirs for human infection include pigs, dogs, and rats. Most lesions occur on the feet, often on the soles and the toe webs, and around or underneath the toenails. As the flea's abdomen swells with eggs, which could be hundreds to thousands, the pressure from the swelling may press upon nerves or blood vessels. Heavy infestations may lead to severe inflammation, ulceration, and fibrosis. Lymphangitis, gangrene, tetanus, sepsis, the loss of toenails, auto-amputation of the digits, and even death can occur. The only effective treatment is surgical extraction. Prevention is by packing all the loose sand where the fleas live packing it very hard into hard mud floors. So that is jiggers.
So many medical conditions require professional attention, expensive medications, complicated interventions, but some don't. We found these children outside their very unkempt mud house. Their mother had recently passed away a few months before we found them, and their father was overwhelmed and oblivious and depressed. And this quote came to mind: "The trouble is that once you see it, you can't unsee it." And how do you walk away from something like this? How do you do nothing? And, we're talking about neglected diseases. I mean, neglect means to disregard, to omit through indifference. Neglect is a choice. And how can we choose to neglect when these diseases affect so many people, over 1.4 billion? We visited these children every day. We cleaned their feet and their hands. We dug out every sand flea. We taught them to dig out the sand fleas with a pin, promising a pair of shoes as incentive to getting every single one out. It was tedious to take out every single flea and larva. In the meantime, we cleaned the house, we fumigated the walls, we packed the floor, we removed the bedding, replaced all the bedding, washed all the clothes. And this is their feet probably 6 months later. You can still see a little scarring, but there's not one flea in there. And this is them several months later. They wear shoes with pride, and they're very happy.
So these are just a few of them, those with neglected diseases. These are the neglected ones. But there are many more. Many times, if not most of the time, they're not out in the open. You have to go look for them. But that's what Jesus has taught. The ostracized are hidden. You have to go find them. Mark wrote in the 4th chapter, verse 35, "And the same day, when the evening was come, he said to them, 'Let us pass over to the other side.'" This is not just a story that occurred a long time ago. It's a story that occurs even today. All of us here should recognize it as our story too. We too have been called to pass to the other side. At first, like the disciples, it will be smooth sailing. But soon the storms of life will come. I don't think I need to belabor the details, but know this: it's not because we're doing wrong, but because we're doing right. We're not off track, but on track. We've not lost it, but we gained it. The storms will try to keep us from reaching our destination, which in other words is our destiny. Sometimes, in the very middle of the storm, when we're so busy fighting for survival, when we're stressing and when we're thrashing, we forget that the one who called us and the one who enables us is still in the boat. He never actually left. Jesus, after all, promised to be with us always, even to the ends of earth. And that's a good thing, because that's where we're going. When they finally reached the other side, the disciples, they met not a pillar from local society or crowds waiting for them. Instead, there was but one ostracized, neglected, lonely man who had no friends, no family, except maybe there was a family, but they didn't claim him. Probably he was a stranger even to himself. Moreover, they had chained him and fettered him. He wore no clothes nor abode in any house, but in the tombs. Night and day he cried out and cut himself with stones. He was not only neglected, he was in agony. When we too get to the other side, people like him, won't be so hard to find All you have to do is just go where no one else wants to go. The story goes, on to say that Jesus delivered the man and he set him free. We can do that too. Don't you think that all those years of school, all the years of training and experiences that we have each had were just happenstance? No, God has been training you all along. He has refined you. He has perfected you. Probably the storm that you just came through to get to the other side was what prepared you the most. Just do what you know to do and help the strangers out. Oh, and while you're doing it, make sure you give them what they need to stand on their own 2 feet. And when the day your departure comes, recall what Jesus said to the man who wanted to go with him. You cannot go with me, but go home. Go to your family, go to your friends, go to the cities and go to the country and tell them what great things God has done for you. And he has had compassion on you. And like in that day, when we do that, all who hear, even in the cities and all the country and all the countryside, all will marvel and all will be amazed. Thank you.